Well, I had had ongoing cardiological problems, and I went through an operation in which I had a bypass as well as a valve replacement. And after 7-8 days in intensive care, it was time to go to rehab.
I really couldn't wait for him to get home from the hospital, but I was also terrified of how was I going to manage this? I'm under 5 feet. I'm a little over 100 pounds. If he needed me, what was I going to do? And this was a constant concern of mine.
The Adventist HealthCare people were, in one word, inviting. The people came and they were cheerful, they were pleasant, and they seemed to really care about my progress.
I used to say from the very beginning of this, it was always Team Feinberg. Who's on our team? Anybody who was around us had to be on our team.
There was a nurse, there was a physical therapist, there was an occupational therapist. All three of which, Pearl the nurse, was here bright and early in the morning, taking my blood pressure, sometimes drawing blood, cheering me up with a little joke, with her infectious laughter, making me feel like, okay, this day's gonna go well.
From the first day I encountered Mr. Feinberg and his wife, of course, being fresh out of the hospital, you kind of encountered that, what I like to call that deer in the headlight type of look. Because they're fresh coming home, they're not sure what to expect. When you teach a patient certain things that they're supposed to do in order to get them healthy again, it's very important for them to follow that guideline, because if you're not following it, you're not going to progress well. And fortunately, Mr. Feinberg, he was the model patient, and he did very well.
Then there was Steve. And Steve, he was the man who put me through the ropes, let me tell you. Steve helped me in navigating stairs, in doing exercises to get up and down out of a chair. Steve helped me in walking. We actually went outside and took some walks. All of these things sound like such simple tasks that anybody could do, but believe me, after you've gone through that kind of surgery, they're not all that simple.
When we come to the house, the first thing I do is I count steps, and I see where the carport is, and I see where the bathrooms are, and that's the first thing we look at is, okay, they're gonna need to do all these things. So sometimes we would go from room to room in this house, and the pictures on the wall he has painted, and everything in here is a collection that he's had. And he had a story about everything in this house, which was a lot of fun for me.
And finally, Diane. With Diane, we practiced skills that I would use around the house. Things, for example, like taking a dish out of a dishwasher, putting it in a cabinet, making sure that I had the manual dexterity to use a knife and fork. She was very encouraging in terms of, you can do this and you can do just a bit more, and just think of how much better you're going to feel down the road.
As an occupational therapist, I work with things that he's supposed to do, that he used to do. He's not a cooker, doesn't like to cook, but we empty the dishwasher. So we looked at bending down and putting things away and changing his head elevation, and he was fine with that.
Yes, I have a daughter and son-in-law who are in Florida, and they have twin boys who turned 2 this past July. And of course, I don't get to see them very often, and although we see them on the Skype on the computer and we talk on the phone, it's not the same as being there. And so to me, it was a goal.
This was something, I didn't know if we were going to make it to this, but it's something that we wanted to do so badly, and our team knew that. Yes, it was difficult. Yes, this may be a day that's not easy at all, but to get to where we wanted to be, we had to keep marching toward that goal, and we made it. And it was so worth it.
Everybody said, yeah, go for it. And I did, and I'm so glad I did. I'm so glad that I had so much help preparing for that trip.
The team that I worked with here, Diane and Pearl, we're not making up how well we get along. We really do get along well. Pearl and I talk to each other probably 3 or 4 times a week.
I feel this is my calling, what I do. I mean, a career is something that we get paid for, but a calling is what God made us for, you know.
And as you can see, he's bloomed. He's done so well. He's lost a lot of weight. He's doing his outpatient cardio. And I know they're both really happy about it. And I know he's going to progress even further.
Just the fact that we're so grateful that all of these people were in our lives at a point where we desperately needed support, understanding, and the highest level of care. And we got it.
This was not only my journey, this was a journey of my family as well. And at every step of the way, there was somebody there from the Adventist hospital, from the rehab section, to say, look, it's going to get better, it's going to get better. Keep at it.